My name is Michael Davitt. I am a visiting general surgery resident in Dr. Longacre's lab. The title of this presentation is Post-Engraftment Sciatic Neurectomy Slows Peripheral Sarcoma Growth. So for a little background, there have been a number of recent investigations into the interactions between visceral solid tumors and the autonomic nervous system, and that have demonstrated positive feedback loops that encourage both tumor growth and neural invasion. However, there's been limited interrogation of one, peripheral somatic neuron involvement in solid tumor progression, and two, sarcoma nerve crosstalk. The significant heterogeneity in nerve tumor signaling across different tissue types highlights the importance of clarifying relevant molecular signaling pathways that are specific to somatic nerve and peripheral sarcoma interactions. This could point towards new potential therapeutic targets, which is important for a disease entity which otherwise has fairly morbid and limited therapeutic options, typically limited to wide surgical resection and radiation therapy. So for this project, we took murine fibrosarcoma cells from the MCA 205 line, transfected them with Firefly luciferase GFP lentivirus, and injected those cells into mouse hind limbs either before or after sciatic neurectomy or sham surgery, thereby creating 4 groups. Weekly tumor measurements were taken using in vitro imaging systems for fluorescence. After 4 weeks of growth, tumors were collected, weighed, and compared to the unaffected hind limb. Tumors were also digested and are in process for bulk RNA sequencing. For our results, we saw that at early time points, the groups receiving surgery prior to tumor implantation measured smaller under examination by IVUS. However, about 2 weeks after tumor implantation, this relationship reverses, which you can see in figure 2. We found that sciatic neurectomy after intramuscular sarcoma cell implantation resulted in slower tumor growth when compared to sham surgery performed before implantation, again, as measured by IVUS and then confirmed by final gross tumor weights, which you can see in figure 3. A trend towards significance was also detected between mice who received tumor cell implantation after neurectomy and after sham surgery. We can surmise from these observations that sciatic neurectomy prior to tumor implantation slows early initial tumor growth, but that progression rapidly rises to match that of sham surgery prior to tumor implantation. In addition, the similar progression rates of post-implantation sham and neurectomy groups suggests a role for postoperative inflammation in disrupting tumor growth, given the very similar rate of progression that we see in mice who receive only sham surgery after tumor cell implantation, and the rate of progression seen in mice who receive true neurectomy after tumor cell implantation, suggesting that disruption of nerve signaling alone is not responsible for this difference in tumor growth rate. There are a number of future directions for this project that could be investigated, including whether sciatic nerve stimulation enhances tumor growth, which would suggest a dose-response relationship to nerve activity, determining whether neurotrophic growth factor supplementation rescues normal tumor growth rate after neurectomy, determining whether neurotrophic growth factor blockade slows tumor growth rate after sham surgery, and further interrogation of nerve tumor behavior across other murine sarcoma subtypes, as well as tumors derived from human sarcoma cells, given the large heterogeneity in cell types that are inherent to the sarcoma family. Thank you for listening to this presentation.